Hello friends, multiple sclerosis is one of the very common disorder nowadays. All across the world people are suffering with multiple sclerosis. Even in India there's been number of people are suffering with symptoms of multiple sclerosis. Today in this video we're going to discuss about what are the causes, what are the symptoms and what kind of a treatment is helpful for the multiple sclerosis patient. We're going to discuss in this video. So see, first of all, our body is consist of all the nerves which is helpful for our all this functioning of the body, and generally this multiple sclerosis is responsible for is the disease of our nervous system, especially brain, spinal cord, and all these nerves are going to affected with multiple sclerosis. So what happened that our nerves is made up of like our cable, uh, it is made up of different parts, and for discovering of these nerves, there has been a sheath is called myelin sheath, and which is the function of myelin sheath is the protection of nerve as well as the cell signaling, that are the main basic function of the myelin sheath. And the main cell that produces or which is responsible for the myelin sheath is oligodendrocytes. And our body, this disease multiple sclerosis is disease is called as autoimmune disease. That means that our body's immunity is killing the oligodendrocytes, so mistakenly this killing the oligodendrocyte. So if oligodendrocytes is going to kill by our body's immune system, that means that our myelin sheath is going to destruct, or sometime it going to make a thin layer, or sometimes it's totally destruct. So due to that destruction of the myelin sheath, all the symptoms is represented in the patient. So the symptoms generally happening that whenever the where is the location of that particular site of multiple sclerosis patch. So the definitely the symptoms is vary according to the location of the disease progress. So many symptoms are arising from the multiple sclerosis patient. So region wise is totally different. So if we consider about the cause of multiple sclerosis, that I have mentioned earlier, that it is the autoimmune process, that our immune system is mistakenly attacking the oligodendrocyte, which is responsible for formation of myelin sheath. That are the very basic cause of multiple sclerosis. Number two cause is genetic factor is also going to responsible in some extent. If the family history of multiple sclerosis, then there might be a chances of future generation to the multiple sclerosis. In some cases, it is also some infectious etiological factor is responsible for multiple sclerosis, including Epstein-Barr virus. There has been risk if the patient is going to get the infection from the Epstein-Barr virus, which causes the disease called infectious mononucleosis, and this patient might be suffered from later the multiple sclerosis. In some cases, it's also considered that some environmental factor also responsible for multiple sclerosis, but there is no strong evidences to which are the fixed or real cause of multiple sclerosis. So symptom basically happen to be in the brain. If certain patches of multiple sclerosis is happen in the brain, some patient even some cognitive functions are going to impaired. Some depression, some people also going to suffer from anxiety, some people also going to suffer from mood changes, mood swings. Some if it happen at the visual problem, visual nerves, they need sometimes affect the vision. Sometimes diplopia, like double vision is also going to symptom in the multiple sclerosis patient. Some optic neuritis also going to common symptom. If it happen to the in the this kind of region, or this nerves, the nerve supplying at this throat region, if they gets affected, then dysarthria, like difficulty in speak, is also some symptom. If it is happen in the or skeletal system, then weakness, then spasm, some ataxic symptom also represented by this irritable this patient, multiple sclerosis patient. If it is happened to nerves that is providing the nerve supply to the abdominal region, these patients are going to suffering from pains, then abdominal irritation, bowel movement disruption. So this is going to the common symptom. If the nerves affecting the bladder region, Some people have urinary incontinence, involuntary urination. These are the very common symptoms represented by the multiple sclerosis patient. But it varies according to the location and disease progress or the disease extent. So what are the treatment for the multiple sclerosis? See, there is no cure in modern medicine for the multiple sclerosis, but definitely in homeopathy there has been number of medicine is available for to hasten the progress of disease. Is definitely homeopathy is really working in most of the autoimmune diseases. Homeopathy is really nicely working. So it also there has been number of people are taking homeopathy as a primary treatment for the multiple sclerosis. I hope homeopathy is going to help you as well. Along with that, physiotherapy also have very good role in the if the our extremities or muscles is getting affected. If the weakness are prominent symptom, then you can also combinedly synergistically use physiotherapy as well. So I hope this video is helpful for you. So thank you so much.